Daraprim was developed in 1953 as a treatment for toxoplasmosis, an infection caused by a parasite. It comes from eating undercooked meat or drinking contaminated water and affects those with compromised immune systems, like AIDS and cancer patients. When Turing Pharmaceuticals raised the price of Daraprim to $750 per tablet last month, the average cost of treatment for patients rose from about $1,130 to $63,000. For certain patients, the cost can run as high as $634,000.
They are considered by many to be some of the greatest crooks and thieves on the planet, those who ply their wares to the sick and elderly and make massive fortunes from taking a drug that cost about $1.50 to make it and selling it for hundreds, even thousands of dollars per pill. But crime continues to pay for companies like Johnson & Johnson, nailed for manipulating and hiding the data about adverse side effects for the drug Risperdal. Pleaded guilty, paid more than $2 billion in penalties, and they go about their merry way, paying what amounts to a drop in the bucket. Add to this a current issue, a former hedge fund manager raising the price of a drug called Daraprim from around $13 a pill to more than $7.50 a tablet. We have a national crisis where people are dying and profits are soaring. Welcome back to the Hardline. Award-winning journalist, author of America's Bitter Pill and the new Huffington Post Highline investigative series, America's Most Admired Lawbreaker, Stephen Brill. Stephen, I want to thank you for joining us, and this is an issue that I could talk about every day because I'm sick and tired of watching people that I know be affected by people like this. Is it not fair to say that these pharmaceutical companies, these individuals, are raising prices and they are frankly sentencing some people to death?
Well, it's the system that we alone in America have. They're just taking advantage of the system. We're the only country in the developed world that doesn't control the price of drugs. When I did my book about Obama's care, America's Bitter Pill, I spent a lot of time describing how the pharmaceutical industry lobbied the Democrats in the Senate and the White House to make sure that there were not provisions put in Obamacare that would do anything to control the price of prescription drugs. So what Obamacare did was it just created tens of millions of more people with access to health care, which I think is a good thing, but the access they got through their health insurance or through government subsidized health insurance basically enabled them to pay the kinds of ridiculous prices for prescription drugs that you're talking about.
Listening to what you just said then, if I didn't know better, I'd swear that the Obama administration and people who created Obamacare, they are simply in the pocket of the drug companies. Everybody's making money, and they don't give a damn who lives and dies.
Well, Obamacare is is the Chamber of Commerce conservative version of healthcare reform, which is why it was first proposed by Richard Nixon and then proposed by Mitt Romney. So it's no surprise that this has happened. It's no surprise that it's going to keep happening. And at the same time, the drug companies are allowed to charge whatever they want. What the series I've just done and revealed chapter by chapter, and I'm revealing now through next week, is that the FDA, which a lot of people think of as a bunch of doctors running around in lab coats who are testing drugs, the FDA basically relies on the honor system of drug companies to submit data with integrity.
Okay, I want you to hold right there if you could for just a second.
Follow the FDA's direction.
You've talked about the FDA, but I want you to hold there because I'm going to come back to them, but I want everybody to hear this. This is the founder and CEO of Turing Pharmaceuticals. This is the gentleman who says that the companies that owned Daraprim were essentially giving the drug away and the public condemning the new price. Well, you, the poor public, you just don't understand the costs associated with distributing the drug. Here's what he said.
So you have distribution costs, you have obviously FDA costs, you have manufacturing costs that not are just included by the cost of goods sold for the pill itself, the ingredients, but also the people that make the pill and make sure that it's made to specification. Those costs have increased dramatically over the years.
Is he lying? Is he just a fraud?
Well, that's just nonsense. I haven't looked at his books, but I can tell you that the prescription drug industry has higher profit margins than companies we think of as the most successful companies in the world, like Apple, for example. And in the case of Risperdal and Johnson & Johnson, where I know the numbers, the drug cost them pennies to make, add a few more pennies per drug for all their vaunted research and development, and you still end up with a drug that produced $30 billion in sales and probably upwards of $25 billion in worldwide profit.
So if we talk about that profit, then is it not fair to say, Stephen, that we've also got doctors to blame? Because we have doctors, medical professionals who are taking millions of dollars in consulting fees, and they're the ones who are making sure that a lot of these drugs get pushed on people at higher prices.
Well, that's certainly the story of Risperdal as I reveal it, which is they took speaking fees to speak at seminars. The more drugs they prescribed, the more likely they were to get these speaking fees. In one case, Johnson & Johnson gave Mass General Hospital and Harvard University $2 million to establish a center for the study of children's behavioral disorders, which touted Risperdal when the FDA had told Johnson & Johnson, don't try to sell the drug to children.
All right, now, you mentioned the FDA earlier. I got about 35 seconds left. Where's the FDA? Where's Congress? Where are all these useless lawmakers trying to protect people? Where are they, Stephen?
Congress is doing nothing, and this is bipartisan. The drug industry basically has both Republicans and Democrats largely in their pocket. There are some exceptions, but when it comes to drug prices and regulating drugs and toughening up the FDA, Congress is nowhere.
There are times when people need to do some research. I suggest everyone do research on your lawmaker. Find out what they're doing. Find out who's in whose pocket here, because in essence, they are raising the price of drugs, and it could kill someone that is close to you, you yourself, your children as well. It is disastrous and it's criminal what they're doing. I want to remind everybody that Stephen Series is America's most admired lawbreaker on Huffington Post Highline. Read it. You need to. Stephen, thank you so much for joining us. We'll look forward to the next time we will continue to push this effort and this issue forward. Stay with us. The fastest 60 minutes in news continues.